Namaste, I'm Dr. Jwala. Welcome back to Arogyanikethanam. Today I am showing a demo on how to give a CPR in an emergency situation. So the mnemonic is Doctors ABCD, DRS ABCD. D stands for danger, look for danger. R stands for response, check for the response from the person. S stands for send for help. So when the response is not there, you have to call an emergency service or call for an ambulance. Then next is A. A stands for checking the airways. Next is B. B stands for checking the breathing. Check for breathing for 10 seconds. Check if the person is breathing. Look at his chest if it is rising and falling. Listen to his breath sounds or feel for his breath. Next is C. Breathing is not there. We move on to cardiopulmonary resuscitations. That is, it includes 30 chest compressions and 2 breaths. So chest compressions are given at a rate of 100 to 120 compressions per minute. That means in a second you are giving 2 compressions. So after giving 30 compressions, we have to give 2 breaths, a mouth-to-mouth breathing, or you can use a face shield or a porous cloth. And if the person is having blood in his mouth, we'll be hesitant to give the mouth-to-mouth breathing. In that case, we have to just continue with chest compressions alone until the help arrives. So next is D, that is defibrillator. If when the ambulance comes, they bring a defibrillator and it can be attached to the chest areas and you can follow the instructions given by the prompts in the defibrillator. And while doing CPR, sometimes the person will regurgitate contents into the mouth. In such situations, you have to keep the person in a recovery position so that you can drain out the regurgitated contents. After that, check for breathing. If he is breathing normally, let him stay in a recovery position itself. So let's move on to the demo. So let's start a demo. The first mnemonic is D. D stands for danger. So look for danger. See if there is any danger anywhere. Next is R. R for response. So see if the person is responding. Ask him, can you hear me? Can you open your eyes? What is your name? Can you squeeze my hands? He's not responding. So we try inflicting pain on him by squeezing his shoulders. We squeeze the shoulders till he's not responding. So next we'll see. Next mnemonic is S. S stands for send for help. You have to call an emergency service or an ambulance. Next is airways. Check the airways. You can check the airways by checking his mouth. See if there is any obstruction in the mouth. If there is no obstruction, then it is well and good. Next, check the breathing. See whether the person is breathing. Look at his chest, whether it is rising and falling according to the breath. Listen to his breath sounds. See if you can feel his breath in your hands. So if he is not breathing, the next step is immediately we have to move on to the chest compressions or CPR. So the site of CPR is important. We have to choose the second half of sternum. Approximately it will be in the middle of the chest, in between the armpits. In the lower half of sternum, keep your heel of the hand there and your other hand above it. Keep your elbow straight. You should kneel down, keep your elbows straight and start giving compressions. So when you start giving compressions, you have to see that the compressions should be at a depth of 1/3 of the chest. So like this, you have to give 30 compressions. After giving 30 compressions, you can give the respiration. So breaths you can either give directly mouth-to-mouth respiration or you can use a face shield. So face shield you can place over the patient's mouth, pinch his nose, lift his chin and tilt his head and then give the breath. After giving each breath, you have to see whether the chest is rising. If the chest is not rising according to the breath given, it means that the breath given is not adequate. So we have to give it in a more pressure. and then immediately move on to the compressions again, like that. So in 1 second we have to give 2 compressions, so we have to give it immediately and never stop it until the help arrives. And in some cases there will be blood coming out from the mouth, or the person might be vomiting. So if you're hesitant to give the mouth-to-mouth respiration, you can just continue with the chest compressions alone. And in between, while we're giving CPR, sometimes there will be regurgitation of contents into the mouth. So we have to remove the regurgitation contents. So we have to place the patient in the recovery position and remove it, drain out the regurgitated contents and see whether the patient is breathing. Look at his chest whether he is breathing, or listen to his breath sounds. Sometimes he might be coughing. So if he is breathing normally, leave him in the recovery position itself. So in an emergency situation, the person afflicted as well as the people around will be in panic. So if someone could do the emergency service required adequately, it could save the life of that person. So if you like today's video, like and share this content and subscribe to the channel for more updates. So next time we'll meet with another topic. Thank you and have a nice day.